I'm Cheryl Crow. I've been living with rheumatoid arthritis for over 20 years, and I'm also an occupational therapist and specialize in helping other people with arthritis.
I'm Dr. Leonard Calabrese. I'm a rheumatologist in the Department of Rheumatic and Immunologic Diseases at the Cleveland Clinic. I'm the head of the section of clinical immunology. I understand that you've had rheumatoid arthritis for over 20 years. I know from experience that it's a journey. Probably there were some times when it was not so great. Can you share any insights or experience about that?
One of the hardest times was the 6 to 12 months after my son was born. My joints were hurting, but I kept just hoping it was about to get better. And my doctor at that point had to have a, very honest conversation with me. And she was able to say, I think that this is your RA.
Sounds like you have a very good relationship with your physician, your rheumatologist, who actually knows you, the person.
I feel very lucky. I know a lot of patients, it takes some trial and error sometimes to find a good fit with a rheumatologist. I was so confused and kind of overwhelmed. She was able to compassionately but firmly say to me at that point, I really think we can do better.
Take me back to a time when you either suspected or figured out that your care plan wasn't working right for you.
Yeah, so the first one was I wasn't really paying attention to how long my morning stiffness had lasted. When my doctor recommended I start writing down how long was it lasting. But when she asked me to pay attention to it, then I definitely noticed that. So that was the first sign. The second sign was I was starting to have swelling and tenderness and pain in joints that I don't normally feel.
What would you have done sooner? What would you have liked to have done sooner?
I wish I knew how important it was to get things under control quickly. Like the analogy my rheumatologist used was like, it's easier to put out a fire in your house if it's just one or two rooms versus when the whole house was on fire. And unfortunately, in my personal case, I think my optimism was blinding me to the fact that my house was on fire. Looking back, I wish I had been upfront that things weren't fine.
So I know trying to find a right treatment plan for you as the individual is difficult, but there comes a time when you just have to address this with your rheumatologist. And I know that takes a lot of work, but it's got to be done for you to get to your goals. If you're living with a rheumatic disease, then talk to your doctor and visit roomfordialogue.com to learn more.